Hi, Ryan. How's it going?
Hi, Zoe. I'm great.
Good
As
to
great
hear.
as I can be. As great
Yes,
as I can be, right?
yes. So tell us about yourself, where you are at the moment.
So, my name is Ryan McManus. I'm the CEO and founder of Share Mobility. I'm here in Columbus, Ohio, in my home, where for probably the last 10 days, I've been staying in for the majority of the day and not interacting and dealing with the COVID-19 response as a founder of a transportation startup.
And so, Ryan, we had on the podcast, I think your episode it went out this Monday, which, as we're recording this, is the 25th of May, 25th of March, 2020. So your episode went out on the 23rd, didn't it? It's not
Yeah,
that long ago.
like yesterday.
Um,
Yeah.
Yeah, yesterday. Oh, yeah, yesterday for you. We're the 25th in Australia at the moment, but so much has happened. So Ryan reached out and we thought it would be a really useful time to just record this with just an update of where Cher and Ryan are at and what the response has been based on COVID-19. So Ryan, tell us a little bit about you're in Columbus, Ohio. What's it like? What's happening there at the moment? Let's start with that.
Sure. So here in the United States, here in Ohio, and specifically in Columbus, we have maybe a half dozen cases here in Columbus in our county. In the state, we have, I think it's around 300, and it's a growing number of cases nationally. And we are in a state of kind of lockdown where you're only allowed out for essential travel. Recently, our public transit agency, they've been adjusting service on a daily basis and trying to allocate resources for more critical transportation needs. So they've been dealing with a decline in ridership, and so have we. Our 2 weeks ago, every day our vehicles were taking people to work, taking people to school, taking people to healthcare appointments. And for the most part, a lot of those activities have been paused. And so we, like many others in shared transportation, are experiencing between an 80 and 90% decline in activity.
Mm-hmm. And for those who haven't listened to the podcast yet, because I know they'll rush and listen to that now, but tell us what Share does specific, or what they did 2 weeks ago, and then
Yeah.
we'll talk about what you're currently doing.
Yeah, so in the simplest terms, we're like a school bus for adults and it runs on our software, but we're a mobility company and we work with enterprise organizations to help people change the way they commute. They schedule their ride to work or school or healthcare with Share. We build dynamic routes based on who has scheduled rides to connect them individuals with other riders who are going to share a trip, and it's offered to them as a benefit. It's an employee benefit or a healthcare benefit or a student benefit, for the most part. And then we have a fleet of vehicles and professional drivers that provide this service.
Mm-hmm. So tell us what's happening at the moment, and I guess maybe start from your initial response, and then where you are now, and as much as it's we can't really predict the future, but your thinking on the future.
Yeah, so what we started to do about 2 weeks ago was adapt and adjust with increased cleaning procedures, reducing the number of individuals inside of a ride, adjusting some of our scheduled times with customers. But very quickly the volume started to decline, and so we wanted to first look at what resources do we have to help, and what can we do in a situation like this. And what we've identified, like many others, not just us, is there's this huge need for delivery services and local delivery services, because for every person that otherwise was traveling in a single occupancy vehicle, they now need something that they were going to get, groceries, things that otherwise. So now we need to look at how we bring things to people. And Uber Eats and DoorDash and all of those companies do a great job when you want to order a meal, right? And But now that we're dealing with what could potentially be 100% delivery requirement in the very near future in a lot of areas, there's far more demand than there is capacity to do delivery. And so you have to do that a different way. And we're trying to get people to do it the share way, which is get you to schedule it, plan it in advance. We batch it, we route it, and we efficiently send it out to our network of drivers. And what we've been able to do is work with other transportation organizations, including public transit agencies, to start working to network all of the capacity. So we've got underutilized vehicles and professional drivers that want to work. So what can we do right now? Well, what we can do is we can serve by making those resources available for transportation, make them available for delivery, delivery of groceries, delivery of prescriptions, delivery of medical supplies and other essential goods. And there's just this new localized last mile delivery problem that right now is going to be really, really significant, but I think it's probably going to lead to a new high tide in what people get delivered. We've been working really closely with another startup called ScriptDrop, and they're doing prescription delivery nationally. And this could be, the type of trend where prescriptions now are done far more through delivery than they are by somebody going into a pharmacy. There's going to be a new normal, I think, after this.
Yeah, I agree. And tell us about, when we were talking via email, you were talking about how many drivers you now have and where you're working and that type of thing.
Yeah, so what we've done in just a short period of time, about 2 weeks, we've networked drivers in over 75 cities across the US. Right now we have about 8,500 drivers that are now on the platform and either doing or will be doing delivery services locally. There's all the shelves are empty right now. If you go to the store, all the shelves are empty. Those will get stocked, but one of the big challenges right now is matching up the supply and demand, right? Because there are masks and gloves and medical supplies in a warehouse. There's probably one medical supply location that has far more and another that doesn't. And all that data needs to come together and it needs to be coordinated. But there's an opportunity to create more efficient delivery networks right now and use up the excess transportation capacity that's otherwise just going to be sitting idle right now.
You said you were working with, say, the transit agency. How is that relationship working? What types of things are you sharing and discussing and that type of thing?
So the first thing is we're sharing what we're hearing from our customers, hearing from the market, what is the need, right? And so we're talking to employers and we're sharing that information about what employers are having people still go to work and are going to need it if in case the bus doesn't run. So a lot of information sharing. We've been ideating. So we've been getting our smartest people together and having conversations and brainstorming sessions about what we can do right now. And what's really interesting about a crisis is it throws timelines out the window and things that might have otherwise just been conversations that happen over a couple of weeks are now happening in twice a day, moving things very quickly forward. And the third thing we're working on is, like regulation. And in trying to figure out how to do these things, we've got to figure out how to do them right. And so what is a transit agency allowed to do? How can they, have their drivers or have certain vehicles be used to do different types of things in a world, in a disaster scenario where we need more local delivery capacity?
Take us through some of the logistics that you're working through, and maybe these are two questions, but the logistics of, the supply and demand and what things you need to think about and what data you're using, that type of thing. but then also, I guess, the precautions that you're putting in place as well to make sure that everyone continues to remain safe. So there's two questions.
Yeah. So let me take the precautions to keep people safe first, and then I'll talk through like the workflow process of what we're thinking of how we work together.
Mm-hmm.
So to keep people safe, I mean, the first and foremost, it's the health of our drivers, and so we want to make sure by putting them out on the road, out when myself included, everybody else is being told to stay at home.
Mm.
We're telling our drivers to go out because we're compelled to serve, but we need to make sure they're healthy. So we also need to ensure the health of our riders and the people we're delivering to. So the first thing we do is we take the temperature of every driver before they start their shift.
Mm-hmm.
Our vehicles are cleaned before and after every ride now.
Mm-hmm.
Previously, we would do it once a day. Now we're doing it before and after every ride. And so there's a high frequency of cleaning. And at the end of the day, the vehicles get an even deeper clean with some harsher chemicals than we had previously used. And then, it's also things like making sure we have policies that help our employees make good decisions about staying home when they're not feeling well. And so, you have attendance policies for good reason, right? But in times like this, we don't want there to be any policy reason why somebody would come to work. And so we've waived all of our attendance policies at this time, and we're also asking that anybody who does stay home because of health reasons gets a doctor's note before they come back. And so that just creates like a healthy environment for our drivers. That's and anytime we're doing delivery, it's all no contact. It's drop and go. So with prescriptions, we're not taking a signature. There's no handoff when we're doing grocery delivery. It's no contact. And then as far as we haven't created a hard and fast rule, but we're very much reducing the number of people that are in a vehicle. Basically taking the number of seats and halving it and saying that's the max, and then kind of making it less than that.
Yeah. Yeah, the social distancing principles, in Australia, that's obviously what we're practicing as well, and continuing to increase the limitations on movement and people gathering together. That people gathering together definitely not happening at this anymore, but then even more restrictions on that, and then that definitely practicing the social distancing where we do have to be in contact with another person.
Right. And then the stages that we're working through, right? The first step is handling requests. So here's a scenario, right? All city bus services are suspended, but there are critical employees that need to get to work that otherwise would have used the bus. So create an intake system for them to call, email, use our app, or fill out a web form and schedule a ride. And we'll, instead of creating routes, create direct service, door-to-door service. So you're intaking the request through a variety of different formats, handling those requests through customer service, something that my team is going to do. One of the great things about Share is that we've got this virtual dispatch team that works, a lot of them work from home anyway. And so now it works just fine. That team handles the dispatching. And so as we're taking in all sorts of different requests, we put those to our software, we build routes, and then we're assigning them out to drivers that could be from a private transportation company, could be an independent driver that's signed on with us, or it could be a van from a public transit agency.
And what types of requests are you seeing a real kind of spike in?
Well, I think it's delivery requests related to prescriptions and health supplies. Those are being prioritized. There hasn't yet been a huge influx in delivery demand for groceries, only because the inventory of groceries is not there to be able to fulfill. So there are hundreds of online grocery orders in cities that are going unfulfilled just because there's not enough supply yet. So once that's there, we see a huge increase. There's been a growing demand to do one-off rides for companies, for just one person that needs a ride. where previously it was always about shared rides.
Mm.
And then, what we also have is we have companies that are just now starting to think about when people go back to work, right? And what I'm optimistic about is that as the entire world is pretty much not commuting right now, right? There's a universal reset in the way that we commute.
Mm.
And so in the same way that people get a new job, they think about, how am I going to get there? Now, we have an opportunity to get communications out to these employees as they're going back to work, and try to get them to think about changing their behavior. And so I'm really encouraged by the amount of companies that are thinking differently about how their workforce is going to travel when things go back to normal. And I think it's really healthy and comforting for people in companies to be thinking that way about when stuff does go back to normal.
Mm. Yeah, I've been having a lot of conversations around kind of the future and hope. We're in a really difficult time right now, and we need to make sure we don't make light of the situation that we've got so many people that their lives are at risk, and we will lose a lot of people, and it's this global community that we're coming together to deal with what we have right now, and respond and make sure that we're making the best decisions possible to keep people safe, but then thinking about the future and having some hope that we can, we'll get through this, and then when we do get to the other side, we'll have a different world that we can shape to really suit what we want it to be, rather than just going back to business as usual.
Exactly.
Yeah, it's something I've been thinking about a lot, and and thanks so much for coming and chatting with me. It's been really great to talk to you.
Yeah.
And I guess
I hope other people will share their perspective of what's going on in different parts of the world, in regards to smart cities and transportation, because it felt like the momentum on smart cities and smart communities was so great, right? This could be looked at as a setback. I think it's an opportunity for kind of resetting expectations.
I think once we get to the other side, it'll be even more important to really focus in on, well, what do we want our future cities and regions and communities to look like? And I also I have some hope once we get through this that we'll be able to have and continue, or hopefully even enhance those conversations. Those conversations will be more important than ever, because we will realize what's important. The other thing that I've been really appreciative of during this time is that we have been able to use our technology to continue to connect with people, and not even just that connection, the human connection, which is so important, but we've been able to use technology and data to actually respond to this crisis. And I think it's really important to, once we get out the other side of that, to really look at that and look at the lessons learned and look at things that we took for granted before, right? Whereas I think we'll be able to really see where we've been able to use that to our full advantage, and in a way that it's not about super flash sexy technology. It's about what applications, what things really served us during this time and will continue to serve people, particularly ones with the most at stake and in vulnerable situations right now.
Really well said. Really, really well said.
Well, it's been so great to chat with you. And
it's great to see you again.
Yeah, you too, given the circumstances. Yeah. But let's talk again soon. I think the situation will change again in maybe in a couple of hours, but maybe in a week or so. I would love to see if anyone else wants to share their story as well, and just
absolutely,
what's happening around the world as we all hold hands virtually together and move through this time.
Let's touch base in a few weeks, because it's hour by hour right now. So
yeah.
Stay healthy.
Yeah, you too, and good luck with everything. And do reach out if you need anything from me.
I will.
Okay, we'll talk soon, Ryan. Thanks.
Thanks, Sarah. Good to see you.
Bye.
Bye.